Food deserts, or neighborhoods that have no grocery store or no store that sells quality fresh meat, vegetables, and dairy, can be found in some of Nashville's poorest areas. Normally created by urban sprawl, food deserts in neighborhoods such as Edge Hill and parts of North Nashville make it difficult for residents to get fresh, healthy food.
Monroe Street Kroger is not within the market area because they're cut off by the highways. And so the only market that those folks had available to them, and most of whom, if you notice, this map also shows people that don't have cars.
Okay.
And you notice that as you get into the lower income areas, you start to really increase numbers of people who don't have transportation. And the MTA, it's getting better, but MTA, it's still difficult using the bus system to get perishable goods.
But it's about more than just convenience. Some believe food deserts also contribute to a community's health.
Living in a food desert has been linked to increased rates of diet-related illness, like obesity, heart disease, diabetes. When people are not able to access fresh, healthy foods, and when there is an abundance of fast food, or people relying on convenience stores to purchase their meals, their diet will follow accordingly.
First, you kind of look at it as a convenience. All you get is no grocery stores. We have to go somewhere else. But now, what this study showed, and others have shown, now there's a couple others that I just read, shown that there's a direct relationship between health and whether or not a community has access to a grocery store, which kind of goes against the stereotype. I mean, the stereotype, especially of minorities or people of color communities, is that we just eat bad foods. That if you have some pork here and some green vegetables here, we're going to go right to the pork section. But that's not true. In a lot of cases, it's due to access. That if people, regardless of who they are, have a choice between healthy and presumably unhealthy foods, they're going to choose healthy foods. But if you don't have a choice, then what are you going to do?
While getting full-service grocery stores in these neighborhoods is the ultimate goal, some temporary solutions like mobile farmers markets and placement of fresh foods in convenience stores have proven effective.
In places where residents and community-based organizations and cities and private sector have worked together to look for solutions to the food desert issue, they've had a lot of success. So I think saying that it's something that the city should be doing, or that the private sector should be doing, or even perhaps the state or health departments, it is probably not the most effective way to move forward, because I think it really is a structural issue and requires effort from so many different kinds of groups to come up with solutions to the food desert issue.